because the Northwest Regional Health Authority, they are modernizing the health information system with the launch of a mobile app, Be Well TT. Also, we want to talk about the electronic health record system. It's a pilot project, and I was already seeing the digitization of the health records of the National Radiotherapy Center and the pharmacy at the St. James Medical Complex. And well, to give us more information on these specific initiatives, we're joined by two personalities. Dr. Rajiv Kisoon is the House Officer at the National Radiotherapy Center and the St. James Medical Complex. And we also have Magda Baksh, who is the General Manager for Health Policy, Research and Planning at the NWRHA. Good morning to you both. Thanks very much for joining us. So, Ms. Baksh, tell us what we're talking about here, because we have two things. Yes. We have the app and the electronic health record system. So tell us about it.
So as you know, the NWRHA is always a pioneer in healthcare in Trinidad and Tobago. And we have a drive for modernization of the hospital information system. And that is basically 4 core components. So one would have been the digitalization of the pharmacy, as you said before, in the St. James Medical Complex. And from that, we were able to comprehensively launch an electronic health record for all patients in the NRC. And Rajiv is going to get into that as well. And also, those oncology patients, if they're outpatient clinics, they can also connect to that network in primary care in the oncology outpatient clinic. And through this electronic health record, we were able to develop an app so that those NRC patients could then benefit from the app with prescription notifications as well as clinic appointments on the app. But any user of the app can really benefit from the health promotion tips as well as the wellness exercises and guidance that's provided through physicians putting information into the app. So it's really an interaction between physicians and patients, but also all users of the app. And I'm going to let Rajiv talk about the electronic health record.
Before he does that, the app is available right now?
It is. It's available in iOS as well as Android. It's free of charge. So the real benefits would be for the St. James Medical Complex NRC patients who can look at their clinic appointments, they can track all of the prescriptions they would have, and then when they get their prescription filled, it would have that electronic notification to them. And if you're someone in Trinidad and Tobago, you know we suffer from a lot of NCDs, non-communicable diseases, and the cornerstone of addressing NCDs is through prevention. So what better way than targeting people before they present to the health center, before they present to the hospital? You yourself can download the app, and I suggest you download the app because it has a lot of tips, health and wellness tips. So some local recipes, there's some Karaili recipes, they're easy to use, easy to find the vegetables. Sometimes we go in the app store, we find apps that we know they really don't apply to us, but this is a local app tailored to your health and wellness.
Well, I could at least get my phone on, so I don't know how much luck I'll have with that, but I could certainly endorse Karaili dal and rice. It goes down very, very well, especially in the dry season. But let's hear from Dr. Kisoon as to the electronic health record system and how beneficial is that in a real sense?
Well, Fazir, that's a great question. And actually, there are many benefits, and I'll just break it down into 3 core groups. So there's benefits for the patient first and foremost, physician benefits and management benefits. And for the physician, speaking on my side of things, having the information of the patient easily accessible in a manner where I can take a glance and have an idea of what's going on with this patient, but then be able to delve deeper, but at the same time not waste time doing this. It allows for a more patient-centric approach, and it allows me to really spend more time with the patient, actually listening to what they do and spend less time on documentation and all of that. So that's one of the key benefits, and for me the big thing. In addition to that, it collects all the information, which is stored very securely, and it allows for us to do further research as physicians, kind of take a look at what's happening with our patient population rather than just using data from the United States or Europe, and enables new pathways for us going forward. In addition to that, when you look at, for the patient themselves, you're looking at a system which allows them to spend less time in clinic, more time with your physician, and therefore your wait times are cut down significantly. You have less issues like things like delays due to paper-based systems, and patients now have integration with the app where they can view when their prescription is due to be refilled. They get an alert. If they lost their clinic card, they can access their appointments on the app itself. So those are just some of the benefits for the patient, but just overall an easier, more intuitive system that allows for those benefits. And finally, for the management staff, you can actually access data on patient volumes, how many people attended the clinic, for what different purposes. the wait times for patients. We can actually see when a patient has reached into the clinic, when they've been seen by the nurses, when the doctor has seen them, when they've started their treatment, when they've finished their treatment. And also with the integration with pharmacy, you're looking at stock levels of drugs. Okay, what drugs are about to expire? Can we move this to a different pharmacy so we don't have wastage? And also as a physician, with the integration, if I'm going to prescribe a medication and I didn't know it was out of stock, I get a notification on the system, this medication is out of stock. So it allows me to prescribe an alternative there and then, and therefore it saves time. So overall, it's just a very intuitive system that was built from the ground up by our partners, really looking at our flow of the clinic, our processes, and optimizing it towards that. So it's not a system that was pre-built and we're just using, it's something that was built from ground up. And
just so we can understand this back, these services are primarily for users within the NWRHA environment.
Well, the electronic health record would be for all patients in the NRC and accessing the NRC, as well as outpatient clinics from the NRC who are accessing services in a primary care site. But the app of itself is for anyone to download and really benefit from the health information that's provided there. But as Rajiv is saying, health is a knowledge-intensive sector. But how do we access that knowledge in a real-time process for decision-making, whether it's clinical decision-making or administrative decision-making? So through the modernization drive, what we've been able to do is access information on our patients to better serve them and to provide a better patient-centric experience, and not just going in, but now you have more control. So now you can get these notifications not on paper but on your phone. So we're going and working with our patients to download the app and make sure they can access their clinic card and make sure they can access their prescription notifications.
What's the feedback you've been getting so far from some of the patients?
The patients in the NRC really like it.
Sure. So there's a general buzz, there's some excitement, because this is something that they've seen elsewhere, and now they're seeing it at home. And our patients, we tend to see them over a long period of time. And so they're recurring patients. So they're coming back, and having seen this change and this new system and how it's affecting the clinic, they feel like there's a general step forward in the healthcare providing by the NWRHA, particularly at NRC. And we've had a lot of positive feedback about the system, just a general buzz of enthusiasm and excitement.
You talked about relying on data from the UK and the USA, and so is there a spin-off benefit that we are able to actually build our own database? Because I mean, you hear different people in different spheres talk about the absence of data, hard data for us here in Trinidad and Tobago. Is that a benefit of this system?
That is probably one of the greatest benefits of the system, is here we are able to collect this data on our patient, our demographics, and then it allows us to do research as physicians, because what might be the most popular cancer and the most popular risk factor in other countries may not be the case in Trinidad. So having the data for our population allows us to make better decisions, not just in terms of planning for prevention, if there are routes that we can take to help prevent this, like Magda said, reaching out through the app, giving health tips and promoting a healthier lifestyle, but also from the management level, this is our most common malignancy, and therefore we need to cater to have enough drugs, and cater enough resources to tackle this problem. So in essence, we can start looking at how is our breakdown in terms of the different types of cancers and allocate funds to buy drugs that will treat these in the appropriate proportions. So there's a lot of knock-off benefits that you're going to see from the system, and I don't think that we'll be able to see it fully right away, but within the next few periods, I think we're going to start seeing some really great change come out of this system.
And Ms. Baksh, before time runs out, just remind us again of the different opportunities here now where people can access the app and benefit from the electronic system that will certainly enhance their experience.
Sure, and I don't know if you could zoom in, but this is the app here, and it's really great. So it's a very clear screen.
If you just hold it up. Yeah,
hold it up here?
Yeah, okay.
Is it working here? So a clear screen with health tips, diet, and a blog. So you can go through the blog and find out more information. You want to quit smoking? There's some information here for you, and information regarding diabetes, information regarding hypertension.
Right, there you go.
I'm not showing myself.
Yeah, right.
And health tips recipes. So we really want the population to take that proactive step, and we are here partnering with you. And we're not going to wait for you to come to the health center or to the hospital. We're going to act before that. We're going to get into your home. While you're there, download this app, get the health tips. Today is the first day to a new beginning, to a better diet, to more physical activity, to cutting out tobacco and harmful use of alcohol. And then really going to end CDs. And we know we have a great burden in Trinidad. We need to start addressing it through prevention.
All right, well, sounds almost too good to be true. Well, you have the chance to go on to access the app and get all the information necessary. And indeed, if you are a patient at the NRC, you could also be part of the electronic health record system, and indeed some good feedback from what we're hearing from Dr. Kisoon as well. So thanks very much for being with us.
I hope you download the app today.
Well, I wish you all the best. I wish me all the best with that. I don't think I've ever downloaded anything in my life as yet, but or any app in that. But anyway, I have children and a wife and so on. They could do that for me in that regard. So hopefully it might turn out to be useful in that regard, to find out what I could do with Karaili other than just dal and rice, which tends to be my preferred option. But again, thanks very much for being with us this morning. And let's hope people really benefit from these new services that are available electronically and online. We'll be right back after the break.